Good morning to you and welcome back in a new year, 2025. And still, I'm going to go ahead and do some practice questions with you, usually on Tuesdays and Thursdays, to help you critically think, let you know what it is that you need to do, especially if you're a repeat test taker. Often the question is, what didn't I do? What did I do, or what caused me not to pass my exam? And part of working with clients is so important to increase awareness. So a child is admitted to the hospital several days after stepping on a sharp object that punctured her athletic shoe and entered the flesh of her foot. The physician is concerned about osteomyelitis and has ordered parenteral antibiotics. Which of the following actions is done immediately before the antibiotic is started? So we have this. If you've been doing it, I encourage you to do safety questions. This is actually a safety question, but if you look here immediately, it also delves into priority or management of care. So we need to paraphrase this. And so we have a child that has a sharp object that punctured their shoe, and the physician is concerned or thinking that the patient has osteomyelitis or concerned about them getting it. And what do I need to do immediately? So remember, what do you need to do immediately? Makes it personal. All right, so as always, I encourage you to have something to write with, something to write on. And then once you ground yourself, looking at your keyword, sharp object, child, concerned about osteomyelitis, order parenteral antibiotics, do immediately. Will it be A, the admission orders are written, B, a blood culture is drawn, C, a complete blood count with differential is drawn, or D, the parents arrive? What needs to be done immediately before the antibiotic is started? All right, go ahead and select your answer. And if we look at this, again, this is a safety. Go ahead and pause and then come back. You're back. Safety and priority question. What do you do immediately? And so before starting antibiotics, it's highly recommended that we do what? That we do blood cultures. Because yes, we could start them on general antibiotics, antibiotics that cover a host of bacteria. However, if we know specifically what we're dealing with, it makes it a lot easier to okay, we need to start them on this antibiotic, given their allergies. So when you look at this question, definitely we want to do blood cultures as much as possible, again, to see what it is that's causing it. Admission orders have been written, so we're not concerned about that, but we're concerned about making sure there's a blood culture that's done. All right. So hopefully that was helpful to you. As always, I recommend that you read the rationales. You're doing questions that have rationales. And so we definitely want to make sure we do that immediately. All right. Talk to you soon.